Hi, everybody. It is Dr. Golden, and this is the Weight and Gold YouTube channel. And I have a great guest here today. Many of you probably know him as one of our clinicians, Dr. Vikram Goyal. So I wanted, especially with it being Men's Health Month, to get him involved so we could have a conversation about not just obesity and weight healthcare, but also about how that is so important in men's healthcare and who else better to talk to us about it. So, Vic, thanks for coming on. And why don't you tell everybody a little bit about yourself, how you got into obesity medicine, and what it means to you?
Yeah, great. Well, thanks for having me, Leslie. Happy to be here and talk about men's health for Men's Health Month. Um, so my path to obesity medicine is in large part thanks to you and your mentorship, but I'm primarily trained as an internist. So I did my training in internal medicine where we kind of focus on the whole body, a lot of physiology. What's the body look like on the inside, understanding diseases and how they impact people as part of total health. So that's always been kind of my interest. How my brain operates is focusing on the whole body, and then how do I put that whole puzzle together. um, I entered obesity medicine a few years ago after I kind of saw the work that you were doing. It seemed very interesting to me about, okay, Leslie's getting to the root cause of a lot of these illnesses. A lot of what I was doing is putting band-aids on conditions, but didn't feel like I was really helping people get healthier or kind of treating, the source of why they weren't feeling so good. So again, with your guidance, after kind of learning a little bit about obesity medicine, I decided to get board certified in it. And I've been seeing patients here in White and Gold for almost 3 years now, I think. Obesity medicine has been a professional journey, but it started as a very personal journey. Obesity is something that I've been dealing with my whole life as a child. And I'd convinced myself for the longest time that just needed some more willpower.
Oh, yeah.
It was it wasn't until kind of I, you know, got a little bit older, got a little more mature, that those things didn't compute. I never considered myself as someone with low willpower. I made it through medical school. I made it through training. Been pretty good about going to the gym for most of my life, but couldn't really understand why the weight wouldn't come off, and went through these cycles and really got down on myself. And I convinced myself that it's just kind of the same things that a lot of people hear, right? Eat less, move more, have more discipline.
Mm-hmm.
But it wasn't until that I understood the science, understood that obesity truly is a disease, that my approach to it really much changed. So, this is a very personal journey for me. And when I see patients in clinic, I talk about my story, right? So, we can relate to each other. Many of the things that they're going through, I've been through myself, right? I've tried everything under the sun. So it's a powerful tool, I think, to have been through that, to treat the disease as I'm actively treating myself in my patients and in myself.
Isn't that it's so fascinating that we see that it's almost this journey of self-healing, of learning, of acceptance, and how we intellectually know that what we've been telling ourselves doesn't add up. But it's hard to face that, right? Because they say that all the time. Oh, willpower, discipline. But we see individuals that are leaders of countries, are leaders of huge corporations, and individuals with incredible willpower, incredible discipline that struggle with obesity. And so what part of that science really helped you realize that? I know we talk to patients about it's not your fault. And what part of that really made a difference for you, and is your favorite message maybe to share with patients?
Yeah, I think I say over and over again that obesity is not a condition of willpower, right? It is a biologic condition, right? The body, obesity is a condition of the brain, right? Not a
Mhm.
condition of willpower. Um, I think the biggest change that I had was when I understood the science that, hey, okay, there's genetics at play here. Certainly there's, my interaction with my environment is at play, and there's always room to understand your environment and your interaction with that environment. But I think when I understood that, hey, there's genetics at play, this is a biologic condition. My brain is defending a certain amount of fat on my body. And even though I'm trying to diet or exercise, when I hit a certain point, my brain wins that battle almost every time, right? When I changed my approach to a little bit more to a more consistent approach rather than kind of an extreme approach, um, when I added medications to my journey in conjunction as a tool to lifestyle change, I've finally been able to kind of meet my goals and sustain those goals for several years now. Things that I've never been able to accomplish over 20 years of desperate efforts.
Mm. And I think that's what's another thing that's so interesting, because a lot of us like to focus on the environment, or society does. It's all about if you're in the right environment, if you're taking in the right foods, then it'll work. And not realizing that not necessarily there's that genetic predisposition, like someone with genetics that defend a lower weight in a challenging environment with a lot of ultra processed foods, they may gain a little extra weight because of their environment, but their genetics protect them still. Whereas someone with genetics that predispose them to holding on to a lot of adipose tissue, they're going to struggle in a clean environment and definitely struggle in a high just interest environment. And I think I see that a lot. I'm reminded watching some of these videos related to the World Cup, where a lot of these individuals that live outside of America, and they're coming to America, and they're like, temptation everywhere. And in America, I think we forget just how much we have access to so much.
Yeah, there's certainly no lack of nutrients in America, but you've seen it your whole life, right? And people will say it. They'll be the person who can look at food and they'll gain weight, right? And then you always know the person who can eat whatever they want, do whatever they want, and they don't gain any weight, right? Mm-hmm. So that's a great example of that. Hey, genetics are a part of this. Again, habits and how we interact with that, of course, are very important. But I don't want to discount that. Some of our brains are more predisposed to interact with our environments a little bit differently.
Mm-hmm. Yeah, and I like that scenario that you just brought up, because I think about that a lot too. Because when an individual is kind of living in a smaller body, we always say, "Oh man, they must have great genes, great metabolism." And I find that when an individual is living in a larger body, but we know them and it's like, gosh, they're doing all this stuff, we don't say, oh, I bet it's their genetics. A lot of times there's this, oh, I bet they're eating more when we don't see them, I bet they're not really working out that hard at the gym. So there's almost this credit we give to someone in one scenario but not in the other.
Yeah. I love the concept of metabolic health, right? Health is more than how we look on the outside, right? What really matters is what's going on the inside. And this was my real kind of passion for obesity medicine. Again, as an internist, I am trained to treat disease, right? And we do a good job of that. We have wonderful treatments available to treat disease. But I spend most of my time in the hospital as a hospitalist. Right? So folks who are sick enough to where their conditions, they cannot be at home, or they come to the emergency room and, hey, things aren't going so well that they require to be in a hospital to be monitored for several days. That's where I spend a lot of my time, treating conditions that are at an extreme phase, often life-threatening if they're not treated within the next few days. Right? And not all of them
related to obesity.
Not all of them,
yeah.
But I think I can say most of them are, right? Mm-hmm. As it relates to men's health, I see a lot of folks that come in with heart disease, right? They'll have heart attacks. Folks that will come in with strokes, congestive heart failure, where the heart's not pumping efficiently and you build up too much fluid on your body, you gain weight, you can't breathe, so you wind up in the hospital, right? Your asthma may flare up, your emphysema may flare up, your diabetes may be uncontrolled, your blood pressure may be uncontrolled. These are all conditions related to obesity. So obesity is at the root of that tree. An analogy that I use in my clinic a lot is that we're very good at kind of cutting off the diseased leaves of the tree. We don't spend enough time on watering the root of the tree so those leaves become healthy or they never become diseased in the first place. I think that's what metabolic health is. What's going on the inside that's causing you to feel the way that you are, right? And treating obesity is an important piece of the puzzle, So again, my claim to fame, thing that I think I'm most proud of and what we do in this clinic is that I de-prescribe medications more than I prescribe them, right?
Mhm.
So again,
Right.
we're getting to the root cause, and those conditions, high blood pressure, diabetes, high cholesterol, skin conditions, asthma, whatever it may be, they go into a place to where they don't require specific treatment for those conditions because obesity or excess fat tissue is the driving cause of why those conditions were flared in the first place.
Right. And I think a lot of people, when we talk to clinicians, especially primary care, about treating obesity, a lot of times the discussions are, oh, we don't have enough time. We have so much to do already. A lot of patients don't want to talk about their weight, right? And I'm just curious for you taking care of patients in the hospital, and now that you have this lens, and you see that they have conditions that maybe they're not having treated by focusing on the obesity, what is your impression? Do you feel like patients are open to understanding these connections and learning how all of this is connected? Or do you see more and more patients getting treatment? Or where do you think that's going?
Yeah, that's a great question. And I, I'll focus on the men as we're talking about Men's
Yeah.
Health Month, right? I think the saddest thing that I hear in the hospital is that, you know, I wish I would have known better. I wish I would have treated this sooner, right? We
Mm,
see a lot
that's
of things that
heartbreaking.
happen. Yeah, it is. We see a lot of things that happen that are a complication of conditions that could have been treated, right? I'll use a heart attack as an example, right? When a young man comes in who has a heart attack, that's potentially a life changing event, right? And if that patient tells me, I wish I would have known that there was options to help me with this, right? I wish I would have known that obesity was a disease. I wish I would have known that, this is not my fault. This is not a willpower issue, whatever it may be, right? That's heartbreaking because, that's where I think my unique expertise can come in and I can help those folks realize that, hey, okay, I know this happened, but there are treatment options available to you. We can talk about how we approach obesity a little bit differently, right?
Hmm.
So I think, people are more open to it. Certainly, there's still a lot of stigma around obesity, right? Particularly in our male population, right? I think I like to joke that the Y chromosome is very cumbersome, right? And I'm speaking from experience.
Right.
It took me 20 years to figure this out, right? And I'm board certified in this field, and it still took me time to figure it out, right?
Hmm.
So I think men are hesitant to seek care because it's whether it's pride or it's fear. I see a lot of fear that they don't want to go in because they don't want to find out what may be wrong, right? Or they think that maybe their conditions are not treatable, right? Or they just
Hmm.
kind of it's manly to kind of power through it. Um, but then on the other side, I hear that when I ask patients what they want, especially my male patients, they all tell me the same thing. I want to be around for my family. I want to be there for my family. I want to be there for my kids. I want to be a good spouse to my wife. I want to see my grandkids, right? I want to feel good when I'm doing those things, right?
Right. So
And
even
those
for
are
men,
things
it's not necessarily about the scale, right? We may think about the scale, but the things that they're wanting are way beyond that.
way beyond that, right?
Mhm.
Of course, for many folks, many patients, our goal is to help them lose weight, right? But
Mhm.
the goal is not to be into a smaller body, right? It's to be a healthier version of yourself. So we go way beyond the scale, right? We talk about total body health, right? Mental health, physical health, what's going on inside the body, what's going on with your total metabolic health to help you feel better, to meet those goals, to do those things that you want to do.
Mhm.
If you're in a smaller body but you feel terrible, what's the point?
Right. And I think we look to it when I look up at the main, causes of ending life for men, heart disease, right?
Heart
Cancers,
disease.
which a lot of people don't realize having more fat tissue on your body than your individual body can sustain increases your risk for many cancers. Um, Stroke. In the last decade, I mean, COVID was, and I think a lot of people, we learned so much about obesity as a risk factor, and what it does to the body in COVID, and I imagine, I know you had a lot of experience with that, and it was
Hmm.
eye-opening. And I think too, further down the list, as we see things like cirrhosis related to metabolic liver disease, and talk
Hmm.
about a silent condition and high blood pressure, all of these silent conditions that are metabolic health, forgetting that the body's connected. And these are things that impact men every day. And I imagine it's a little bit of that silent health issue and internalized weight bias and stigma that we all experience. But
Yeah.
do you think there's a little bit of that male identity that comes into it, of like the size being a protector and being strong and reducing body size? Do you think that's a challenge at all?
Um, Certainly, right? And
Mhm.
I think this is where there's a big misnomer around weight loss, right? Um, in short, muscle is medicine, right? And that's why I think utilizing medications or helping someone sustainably and lose weight in a healthy fashion has a lot to do with what's going on with our muscle, right?
Mhm.
Muscle is medicine, muscle is king. So we talk a lot about that, and a lot of my male patients, they'll be experiencing fatigue, soreness, lack of motivation. Maybe they're not sleeping well. Maybe they're feeling a little depressed. Maybe they don't like the way they look, right? And a lot of those things are related to, they'll often blame aging or just, not taking care of themselves. But a lot of those things are related to our visceral fat tissue, or kind of, in short, our belly fat. That fat sends a lot of noise or inflammation to the brain. Um, and insulin, kind of what's going on with insulin and insulin resistance. And again, what's going on the inside, our metabolic health, is probably resulting in a lot of those symptoms that you're feeling. So, under the guidance of a professional, you'll be guided to make sure that you don't lose your muscle mass. Losing muscle mass is detrimental to health. That's the last thing we want, right? We help guide patients on how to lose fat tissue, how to maintain their muscle mass so they can feel good and they can look good.
Mhm. And with thinking of men's health, I think this is such an important topic, because not that they're not important. I mean, prostate cancer, colon cancer, all of those things that impact men, but that's often what Men's Health Month ends up getting focused on. And we miss the heart disease and the other conditions like this. Do you have concerns? Because I've seen a lot of the Men's Health Month focused here lately on testosterone replacement and this, maybe are we pushing the focus on strength and things like that potentially too far? Are there risks there? Do all men feel like that's relatable? And does that define health and wellness for all men? How do we balance these messages of, yes, muscle health is important, but we're not saying you have to be a fitness athlete to be healthy, and the concerns about the messaging around testosterone replacement and peptides and all of this that's out there focused on men almost being preyed upon for
Mhm.
their desires of what it means to be a healthy man today.
Yeah, yeah. You can't talk about men's health without talking about testosterone in this day and age. So, um, my perspective on that, again, as an internist, where my job is to understand the physiology of the whole body, right? Testosterone is an extremely important hormone. It is one of thousands of hormones that are important, an important piece of this puzzle, right? So yes, testosterone plays an important role, but for most men, low testosterone is not a result of a failure of the primary organ that produces that, right? It's a result
Mhm.
of how that testosterone is utilized in the body, right? So again, going back to the tree analogy, we're very good at addressing the leaves of the tree. So yes, of course, you can supplement testosterone, right? If it's low, maybe it's not, and maybe someone is taking that when they really don't need it. But it's not going to change how that hormone is utilized in your body. Um, and testosterone, like anything, is very dangerous unless it's used and prescribed correctly, right?
Mhm.
So I get a lot of questions about it. It's important, right? It needs to be monitored. It needs to be tested. We have all the parameters to do this safely. And in some patients, it does need to be supplemented or replaced, right? But I can tell you that it's overutilized because patients are experiencing those symptoms of fatigue, low energy. Maybe they're not happy with their sexual health, right? Maybe they're gaining weight and they don't like the way they look. Maybe they feel their muscle mass is low, and yeah, I think, many men in society want to feel like they have good muscle. They want to be strong. They want to look strong, right? Uh, but testosterone it's one piece of a very complex puzzle, right?
Hmm.
There are other ways to normalize and stabilize your testosterone by, again, nourishing the root of the tree that's causing that hormone to work abnormally in your body.
Because we know that as individuals develop obesity, even things like if they have untreated sleep apnea, et cetera, all of those things can contribute to abnormal testosterone levels. And sure, you could give someone testosterone, but or if you focus on treating those things, when we treat obesity for an individual, their testosterone communication in the body improves. So, like you're describing, do we want to keep clipping off the trees, pruning, or do we want to treat the tree itself? And I think that's a good reminder. Any thoughts in particular about our aging male population? Because that's a concept that comes up in a challenge at times, where this idea of how old is too old, using some people's language, to treat patients, male patients we can talk about in this setting, that may benefit from obesity treatment? When are we worried about frailty, and is frailty always a concern in our patient population?
Um, it's a concern, of course,
Mhm.
right? But again, I think that's why, um, like any field of medicine, you need someone who's experienced, who understands the nuances of what you're treating and why you're treating, right? So if I have an elderly patient, um, I'm paying very close attention to their muscle mass, right? Again, I have access to the tools that allows me to measure how much muscle is on your body, where is it on your body, how much fat tissue is on your body, how do those two relate to each other, right? Because if I have a patient, let's say, who's in their 70s or 80s, who wants to reduce their weight because they want to be healthier, of course I'm going to support them, right? But
Mhm.
I'm paying particular attention to their muscle mass in that scenario, right? Because I know that, a significant loss of muscle could be detrimental to that patient, right? Muscle has so many metabolic effects where it protects, it kind of stabilizes, it works as a buffer for all our hormones. But in this population, it's very important for mobility, right? It protects your
Mhm.
joints, it protects your ligaments, it allows you to be mobile, allows you to move safely without falling, protecting against fractures. So I'm very conscientious of what's going on with muscle, and having the right tools to measure that safely and kind of remeasure that as we go on this journey is of particular importance in that population.
Mhm.
But the short answer is it's never too late, right? If you're in the right mental place where you want to change your health, you want to improve your health, it's never too late.
Mhm. And I've had some beautiful conversations with patients where, we like to ask at Weight and Gold in that first meeting, like, what does success look like for you? What are your goals? And I had a patient once tell me, that was in their 70s, I just want to not hate my body for the first time in my life.
Mm,
And
yeah,
I think that just really shows that of it's not always just about the scale, and we have other ways that we can help people. And also too, we have that advantage of actually, since we keep obesity care within healthcare and we're not using asynchronous type visits and those kind of things, we get to actually see and engage in our patients. And if some I can see as my patient walks around in the office, and as they can get themselves up and in and out of a chair, I can see their functional capacity, and I can see if they truly are at risk of frailty or not. And I have that ability to know how quickly I need to follow up with them, and keep an eye on them and see that progress.
yeah, for sure. It's of utmost importance, right? I think we follow our patients closely for that reason, because as they go on this journey, we want to make sure they do it safely, right? And they're meeting their goals. So I think, yeah, our patients experience good outcomes, and they're happy because they feel better, right?
Hmm. Yeah,
Yeah.
absolutely. Well, what kind of advice would you give to like a man that may be watching today, or what would you say to them if they're not sure ab- about seeking this care?
Yeah. Um, I think I would say I've been there, and please don't make the same mistake I did by delaying for years and years and years, right? Um, Obesity is not a matter of willpower, right? Most patients with obesity have tremendous willpower, right? Um, so if you're not loving the way you feel, if you feel like weight is contributing to your health and you want to make a change, don't delay care. This field of medicine, when I went to medical school, essentially did not exist. Um, the science behind it is remarkable, right? Our ability to treat this, we have real tools, real science at our disposal to help people and treat this condition now, right? Obesity is not an opinion. Nutrition is not an opinion. It's a science, right? And it's a sound science. So, my advice is don't be me, don't delay. Get treated. There's options for you to feel better and be in the body that you want to be in.
Yeah. And I love that reminder of this is a science. This isn't an opinion. It's not, because sometimes I hear, and sometimes I'll say, I believe obesity is a disease. And I have to remind myself, oh, this isn't a belief. I mean, obesity is a disease. And I have the evidence to support that. And I think pivoting over from that, I think my other thought, or just curious what you would say about this, because we know that so many men often are influenced by their family members and their encouragement for health or not. They used to, I don't know if it still exists, there used to always be this comment about men that are married end up living longer because their spouses schedule their appointments for them and force them to go in. And so if a spouse of a man that may need metabolic health care is listening, how would you suggest to have that conversation or to help them in a compassionate, non-judgmental way? Because I mean, it's not as easy as saying like, hey, I think you would benefit from weight loss. Let's schedule an appointment, right? Because that can be a conversation that could actually make it worse for the patient. Any advice on how to lovingly have these conversations?
Yeah. Again, I see a lot of this, right? And I see a lot of frustration and spouses on both sides, right? But it always comes from a place of love and a place of fear, right? They're afraid that their loved one is going to get sick and they don't want to see that happen. They want many more healthy years together, right? So I think my advice would be for the spouse is that, seek to understand, right? People are not dumb. They know their bodies, right? They know the way they're feeling. So seek to understand why it is that they're hesitant to seek care. I guarantee you there's an element of fear involved. I guarantee you there's an element of lack of understanding or misunderstanding involved. I guarantee you there's an element of a little bit of hubris, right? But, I would say seek to understand and try to learn why someone is resistant or hesitant to seek care, right? And again, this field has changed dramatically. I get it why people are afraid or not interested, because I did this myself. For years, I told myself and my patients, eat less and move more. That was my understanding of how to change your health, right? Even though we disproved that about 100 years ago.
Right.
But now we understand the science, so we can provide real advice to you now. We can provide real treatment if you need it, right? Mm-hmm. The other thing I see all the time is patients get so scared that I'm going to ask them to diet, right? Yeah. Especially my male patients, they don't like being hungry. And I get it. I don't like being hungry either. I hate being hungry, right? And they're so fearful that I'm going to ask them to diet and restrict, right? But again,
take away their favorite foods and their favorite activities and their
Right. That's the opposite of what we're going to do, right? We're going to learn how to utilize those things in a healthy way. We're going to understand how your body works, how your environment works, and how to make better decisions, right? But I don't want to ruin your life. I want to help you make your life better, right? So again, I think science has changed so dramatically. Our understanding has changed so dramatically. So seek to understand why there's hesitation, and just know that, hey, things are a little bit different now. And at least give it a try if it's important to you.
Well, we'll finish, I think, with one myth, maybe. I know there's so many, But if there's one myth that you could retire in obesity treatment,
Ooh,
or just
okay.
about weight in general, what's the one that you would try to retire if you could?
The one that I see everywhere, and I'm still trying to convince myself on certain days, is that obesity is simply a matter of willpower, right? And it's just not true, right? Um, we're very good at blaming folks, you know, for their conditions, right? And of course, there has to be some discipline and some change that's involved, right? But obesity is not a matter of willpower. It's a real disease. It's impacted by so many factors: genetics, our environment, and 1,000 other things I can go on and on about. But obesity is not a matter of willpower. It is a real condition, and there are real doctors like the two of us who know how to treat it. So, if it's impacting your life, go get some help.
Love it. Well, thank you, Vic. I mean, I knew this would be a great conversation because I get to talk to you about this stuff all the time. And
Well,
I
thanks for having me.
I appreciate you sharing it with our community and all the work
Of
you do
course.
for our patients. And so those of you listening today, if you enjoyed this, please like and share, because there may be a man in the community that isn't in your immediate community that may need to hear this. And if you need caring, compassionate clinicians, you can come and see some of us at Weight and Gold. Have a good day, everybody.
Thank you.